Loved by some and feared by others, it promises strength, size, and jaw-dropping results. But is it really that simple? In today's video, we're diving into the mysterious world of this favorite compound that so many people talk about. The famous Nandrolone is an anabolic androgenic steroid that belongs to the 19-nortestosterone family. Basically a tweaked version of the testosterone molecule designed to boost muscle-building effects while reducing androgenic ones like excess hair growth or voice changes. In gyms, it became widely known by its brand name, Deca-Durabolin, which many have heard of, especially among bodybuilding enthusiasts. But do you actually know what this substance is and how it really works in the body? When we talk about Nandrolone, it's essential to understand that it was created for serious medical purposes, not for cosmetic muscle gains. One of its main uses is treating osteoporosis and osteopenia, conditions where bones become weak and more likely to fracture. Nandrolone works by increasing bone density and slowing down bone resorption, acting as a true ally to the skeleton in specific clinical cases. Another important medical use is in the treatment of severe anemias, like aplastic anemia, when the bone marrow can't produce enough blood cells. It is also prescribed for anemias caused by chronic kidney failure or by chemotherapy, which weakens the body and lowers the red blood cell count. Nandrolone helps stimulate the production of these cells, improving oxygen transport in the blood and enhancing the patient's quality of life. This compound is also used in extreme catabolic states, situations where the body is rapidly losing muscle mass. This can happen in severe illnesses, after major surgeries, in extensive burn cases, or during prolonged infections. In those cases, Nandrolone helps rebuild tissue and preserve lean mass, supporting faster and more efficient recovery, always within a hospital setting and under medical supervision. For weakened patients, regaining muscle and strength is not just a matter of appearance, it's about survival. Muscle mass directly impacts mobility, breathing, and the ability to fight infections, making Nandrolone a valuable medical tool when used carefully. Even so, its use is temporary and strictly controlled to avoid adverse effects. The anabolic effect of Nandrolone also shows in its ability to stimulate tissue repair. It can speed up healing and recovery after trauma or complex surgeries. But there's no magic pill here. The treatment only works alongside proper nutrition, physical therapy, and medical follow-up to ensure the body responds well. Each medical case requires an individualized assessment, and the dose, frequency, and duration of treatment depend on lab tests and the patient's overall condition. Self-medicating with Nandrolone is extremely risky and completely discouraged, since what is therapeutic for one person can be toxic for another. Finally, it's important to remember that Nandrolone was not designed for healthy people to chase aesthetic results. Its true role is treating serious conditions, improving quality of life, and speeding up recovery in very specific situations. Its administration must always be by deep intramuscular injection performed by a trained professional, like a doctor or nurse. This means the substance is injected into a large muscle, such as the glute or thigh, ensuring slow and effective absorption. It should never be taken orally or injected intravenously, and self-administration carries serious risks and can lead to dangerous complications. The medical doses vary according to the goal. In osteoporosis, treatment is spaced out, usually around 50 milligrams every 3 weeks. In situations of negative nitrogen balance, where the body is losing more protein than it can replace, typical doses range from 25 to 50 milligrams every 2 weeks, helping the body recover without overloading it. For anemia treatment, one of Nandrolone's classic uses, the doses can be slightly higher. Depending on the type of anemia, doctors may prescribe anywhere from 50 to 200 milligrams per week, always monitoring blood tests to track red blood cell production. This careful monitoring is essential because unnecessarily high doses do not accelerate recovery. They only increase the risk of side effects. When it comes to women, things get even trickier. In very specific and closely monitored cases, some patients might receive tiny doses, usually around 50 milligrams every 2 or 3 weeks. Anything higher drastically raises the risk of virilization. meaning a deeper voice, facial hair growth, and changes in the menstrual cycle. That's why female use is extremely rare, very cautious, and almost never seen outside a medical setting. Now, if we shift to recreational and performance use, the story is a whole different game. Many athletes and bodybuilders inject doses way above what's recommended medically, easily hitting 300 milligrams a week, and in some underground, hardcore cases, going as high as 1,200 milligrams per week. That's several times the therapeutic dose, and the risks climb just as fast as the numbers do. In gyms, Nandrolone built its reputation as a fast track to muscle growth and major strength gains. Among lifters and bodybuilders, it's a staple in so-called bulk cycles, designed for packing on mass. The goal is to create a highly anabolic environment where the body can build muscle at an accelerated pace, especially when combined with heavy training and a high-calorie diet. One of the most common practices is stacking Nandrolone with testosterone. This strategy tries to work around one of the main issues with using Nandrolone alone: sexual dysfunction and loss of libido, which can show up when your testosterone and Nandrolone ratio drops too low. Running both together can help preserve performance in that area while promoting mass gain, but it also ramps up the stress on the liver, kidneys, and cardiovascular system because you're putting more hormones into circulation. The goals users chase are pretty clear: muscle hypertrophy, raw strength, and faster recovery between brutal training sessions. People who use it often say they can train harder, lift heavier, and bounce back quicker with less post-workout soreness. That feeling of rapid progress is one of the biggest hooks that pulls people into the world of anabolics, especially because the visual results can show up within just a few weeks. Recreational Nandrolone cycles typically run 8 to 12 weeks, depending on the user's experience and the other compounds in the mix. Beginners usually keep doses on the lower end, while advanced athletes may jump into aggressive protocols that are several times the medical dose. This is where danger really kicks in, because every extra milligram means a higher chance of serious side effects and deep hormonal suppression. A lot of people believe Nandrolone protects the joints and reduces pain, making heavy training easier. The truth? That effect is more myth than fact. What actually happens is that Nandrolone can increase water retention, which temporarily lubricates the joints and mass discomfort. That's risky because feeling invincible under the bar can push someone to lift heavier than their body can safely handle, keeping the real injury risk alive and well. Another critical point is stacking multiple anabolics, the infamous stacks. Hardcore bodybuilders and extreme users often add compounds like Trenbolone, Dianabol, or Stanozolol, creating cycles with sky-high impact. Sure, the gains can be insane, but the risks to the heart, liver, and hormonal balance multiply fast. In theory, cycles like this demand constant medical monitoring, but in reality, many users skip it entirely. Whenever we talk about Nandrolone, we can't just focus on the rewards. Every anabolic steroid comes with side effects, ranging from mild to severe, depending on dose, duration, and individual sensitivity. Even in supervised medical use, some signs show up, and anyone considering it needs to understand the risks first. The most common side effects include injection site pain, nausea, vomiting, water retention, and swelling. Many people also see rapid weight gain, which isn't always pure muscle, because water retention can be significant. On top of that, cholesterol can shift and blood pressure can climb, both of which, if ignored, set the stage for long-term cardiovascular problems. On the skin, side effects often show up as acne and increased oiliness, especially for people prone to it. These might seem minor and are often brushed off by recreational users as part of the game, but they're a clear sign that the body is being pushed far past its natural limits. For men, the specific side effects are hard to ignore. Using Nandrolone can trigger painful or prolonged erections, prostate enlargement, and a reduction in sperm production, which in some cases leads to temporary infertility. One critical detail is that if the testosterone to Nandrolone ratio drops below 2.5 to 1, the risks of sexual dysfunction skyrocket, including loss of libido and even impotence. For women, the risks are even more delicate because even small doses can cause virilization. This means a deeper voice, increased facial and body hair, menstrual irregularities, and clitoral enlargement. Some of these effects can be permanent, even after stopping use, which is why abuse among women is especially dangerous. Then there are the severe effects that demand immediate attention. The liver can sustain serious damage, which shows up as jaundice, yellowing of the skin and eyes, dark urine, and intense abdominal pain. Severe allergic reactions are also possible, bringing swelling, difficulty breathing, and even the risk of anaphylactic shock, although these are less common. These are the body's way of signaling that it cannot handle the substance. In the end, the higher the dose and the longer the use, the greater the risk. Many users underestimate the dangers, believing that only professional athletes face consequences. The truth is that any body will react to abuse, and ignoring these warning signs can lead to irreversible damage. When considering Nandrolone use, it's critical to understand that the risks go far beyond the immediate side effects. This steroid has a direct impact on the hypothalamic pituitary gonadal axis, which regulates the body's natural production of sex hormones. Nandrolone suppresses this axis even more aggressively than testosterone, meaning the body can forget how to produce its own hormones for a period of time. This hormonal shutdown carries serious consequences: loss of libido, erectile dysfunction, and in more severe cases, temporary or even prolonged impotence are all on the table. For men, this can mean temporary infertility and emotional struggles, since hormonal balance doesn't just control the physical, it also affects mood and motivation. Many users only grasp the severity of the risk once they are already facing these issues. Using Nandrolone without medical supervision makes complications far more likely. Recreational cycles, with high doses and no lab monitoring, can leave users with irreversible effects, like voice changes, excess hair growth in women, persistent sexual dysfunction in men, and even gynecomastia. Without supervision, the user is essentially blind to the warning signs their body is giving. Nandrolone is also off-limits for entire groups of people. Children, pregnant women, and nursing mothers must never be exposed to it, as it can disrupt hormonal development and harm the baby. Men with a history of prostate or breast cancer are also at risk, since Nandrolone can accelerate the growth of hormone-sensitive tumor cells. Another crucial consideration is the risk of allergic or hypersensitivity reactions. People allergic to Nandrolone, soy, or peanuts, which are sometimes used as carriers in the oily ampoules, can experience severe reactions, including swelling, breathing difficulties, and the danger of anaphylaxis. This is why reading the leaflet and performing a medical test before any injection is essential. To minimize risks, experts strongly recommend ongoing medical supervision with regular blood work to check hormone levels, liver and kidney function, and lipid profile. In some cases, post-cycle therapy, or PCT, is necessary to help the body restore its natural hormone production after stopping use. Skipping this step is one of the main reasons side effects can linger for months or even years. When we talk about Nandrolone, countless myths circulate in gyms and online forums, confusing beginners and even experienced athletes. One of the most discussed points is the risk of gynecomastia, that unwanted growth of breast tissue in men. Unlike other steroids, Nandrolone does not directly aromatize into estradiol, the main hormone responsible for gyno. This means the risk is lower, but not zero, because it can convert into progesterone, which can also trigger the problem in certain users. Another popular myth is that Nandrolone relieves joint pain and protects the joints. This belief comes from the fact that many users report feeling more comfortable during training, especially with heavy lifts. However, this effect is more like that of a corticosteroid. It masks the pain without truly treating inflammation or regenerating the joint. Relying on Nandrolone to lift heavier without pain can be dangerous and may lead to even more serious injuries. There's also the widespread idea that Nandrolone is one of the safest steroids, and in a sense, compared to compounds like Trenbolone or Dianabol, its side effects can be more predictable and manageable. But safer does not mean safe, especially in the context of recreational use or doses far above what is prescribed in medical treatments. This false sense of security is exactly what leads many people to take risks without fully understanding the consequences. Many users believe that because it's popular among bodybuilders, recreational use is simple and straightforward. But in reality, every body reacts differently. A poorly planned cycle can lead to prolonged hormonal suppression, cholesterol imbalances, loss of libido, and even psychological issues. Even experienced athletes rely on PCT, post-cycle therapy, and regular lab work to try to reduce these risks, and there are still no guarantees that they'll come out unscathed. Another hot topic is the detection time of Nandrolone in anti-doping tests. Few people realize that its metabolites can remain detectable for up to 18 months, depending on the dose and the type of test. For professional athletes, this means that even a single injection could compromise an entire season. It's no wonder so many famous sports suspensions have involved this steroid. Amid so much information and misinformation, one thing is clear: Nandrolone is not a magic shortcut. Recreational use requires knowledge, medical supervision, and extreme caution, and even then, there's no guarantee of avoiding side effects. In the end, the difference between myth and truth always comes down to reliable information and the awareness that the risks are real and must be respected. So, what did you think about learning all the details on Nandrolone, its uses, risks, myths, and truths? Our goal with this video was to deliver clear, no-nonsense information so that you can truly understand what's behind this steroid so widely talked about in the bodybuilding and fitness world. Now I want to hear from you. Which of these facts surprised you the most? If you enjoy content like this, don't forget to leave a like. That simple gesture helps the channel grow and shows us that you want to see more videos like this. And if you want to support our work even further, consider becoming a channel member. Also, make sure to subscribe if you haven't already and hit the notification bell so you never miss a new video. Every week, we bring you content on training, nutrition, bodybuilding history, and in-depth analyses of substances that are part of the lifestyle for anyone who loves this sport.